Let's bring in our very good friend, Dr. Joe Congini, Sports Medicine Center at Akron Children's Hospital this morning with us. Joe, good morning. What do you have for us today?
Hey, good morning, Ray. Yeah, I couldn't let the opportunity pass as we've worked on this, and a lot of the talk around sports medicine is about Tua Tagovailoa, Tua and the eye in the sky, right?
Mm-hmm.
So one of the changes, Ray, that was made now 5-7 years ago was really trying to have independent people looking in to see if some of these players that are injured on the field could actually have movement pattern abnormalities that could fit with a concussion. And, prior to a lot of the rules changes 5, 7, 8 years, 10 years ago, these players were routinely returned to games. I thought certainly in the high school setting, of course in the pro and the college setting, we saw it quite a bit. And it often led to a situation that we called cumulative concussions. So what would happen is the brain doesn't have a chance to recover, and the athlete would be hit again and again repetitively. And we think that led to more significant concussions. And in the battle to try to reduce the issues with concussion, as we made rules changes, one of them was related to this problem. And so in the NFL, they came up with putting a certified athletic trainer up in the box, looking down on the field for anybody who might have these abnormal patterns of movement that could be the possibility of a concussion, and an independent neurologist on the sidelines, so they're not under the pressure of being with a team, and they could make an independent evaluation of these. And so that's been in place for a while. I think it's beneficial, but I'm going to go so far as to say being around a lot of high school, college, even youth sports, there's sort of an eye in the sky now, Ray, and this isn't just for football. This is for soccer, basketball, lacrosse, wrestling, and many others. When an athlete is injured in those sports, nowadays officials can see these abnormal movement patterns. If you saw the play with Tua, it was, a pretty obvious movement pattern that had them concerned. An official, a innocent bystander, hopefully a certified athletic trainer is picking up on these things right away. And really, even in our office, in our concussion clinic, a lot of parents come in and they have video of the kids where it's videoed and you can see a kid being injured and having these abnormal movement patterns. And the big take-home point is these kids and young people should not be returned to play. The guidelines that came out in 2014 said that these people are not allowed to play on the same day, that they need to be evaluated by medical personnel. They need to be placed in what's called the protocol, the concussion protocol, which keeps them out for a period of at least 5 stages after the brain is recovering, and that they have to be cleared by medical personnel to come back to play. And it seems like that period of time off in the protocol has been a good buffer zone for these people to recover, for the brain to recover. The checkup by medical people has been a good point of allowing people to go back so that they don't go back and get these cumulative concussions, additive, where they're getting worse, one concussion after another, no matter what the high school or junior high sport, let alone at the professional level as we saw on Sunday. Now, unfortunately, on the play with what happened on Sunday, there's a lot of controversy about it. At least it's got people talking about it. The NFLPA has an investigation ongoing right now. A lot of people have weighed in now in the day of social media. In fact, I saw the forensic pathologist from the movie Concussion, Bennett Anwalu, weighed in, and he was very adamant that Tua should not have returned on Sunday. From my standpoint, I just have to trust that the process took place. Did they evaluate him? Did they have the time and a place for a good, full evaluation before they returned him? And certainly during the week, doing the right things in that situation. But it did bring up the eye in the sky, and I think everybody now is pretty tuned in to looking for that kid that doesn't look right, that looks like that movement pattern with concussion. I'll tell you, our officials have been very helpful in high school sports and junior high sports, in any of those sports I mentioned, soccer, basketball, football, And so I think that is a contributing factor to why we're doing better 8 years, 10 years later, because we're not having as many of those cumulative concussions where kids went back to play when the brain was still injured.
Well, and the thing with, as you go all the way back to the beginning, Joe, when you look at Tua on Sunday, took quite a big bop. He was saying it was the back that had him feel very gingerly and not the head. And from what I've been reading, a lot of times it is the back sometimes that will get them wobbly. How do you feel where the NFL is right now on their concussion protocol? Do they still have a ways to go?
We all have a ways to go, and we're trying to learn new things that we can add to the rules changes and other things to make it safer and safer. But again, in the last 10 years, I think we've made good strides, and I think this was one that was very good, where you look, and if somebody sees this movement pattern, the athlete needs to be checked out. Again, I'm not going to second-guess what happened in the locker room. You go to a quiet place. The evaluation is not a 2-second evaluation on the sideline, 10 or 15-minute evaluation. If it was back with him, and that's good. They have the ability in the NFL to have the independent neurologist. That's really helpful. There's a lot of pressure on the team docs to get these players back to play. The independent neurologist and the trainer in the certified athletic trainer up in the box are two really good things, but that's pretty unique to the NFL to have those. Yeah, I think that is helpful, and then followed by people being put into the protocol to give the brain some time to recover. I think those things have been helpful, but I'll tell you what, Ray, we're not done. We're up there. We're still looking here in 2022 to come up with new ways all the time, but I'm pretty happy with what we did in a decade ago. I think those things have helped out a lot, and I think in situations like this, I see it every week, every month, going on in a bunch of different sports. And I think these things, that eye in the sky, people looking in, has been a beneficial part of it. And then getting people into the protocol and making sure that they're evaluated by somebody before they return to contact sport.
Joe, great stuff this morning as always, my friend. Thank you for the time.
All right, Ray. Have a great week.
You too. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital with us.